I'm Octavia Tyson. I am the therapist for the South Side, and this is Kimmons.
I'm the Support Services Coordinator, and we're here from the Chicago Women's AIDS Project. We empower women to take control of their health and to live as fully and productively as possible. And we provide education, advocacy, and support for women who are living or at risk for HIV.
One of the things, too, that's very unique about Chicago Women's AIDS Project is that we are not a clinic. We are an office with confidential spaces for our therapy services. We don't provide like referrals and that type of thing. Once you come to CWOP, you're kind of in CWOP for all of our services.
And some of those services, as Octavia said, is we do provide therapy. We also provide support groups for women who are living with HIV. We have support groups on the Northwest and South Side. Another program called Sisters Reaching Out, which is for women who are formerly incarcerated, and it trains them to be health promoters in their own communities, and at the end of that they graduate and get to go forward and educate other women on health issues. One of our programs is called Project SAS, which we both take part in, and it's a program for women who are living with HIV, and it's a program that educates them on issues of health, healthy relationships, how to get support, and how to take care of themselves, and at the end they get a certificate and they get a graduation ceremony, and it's a really great 5-week program.
There is a big difference between HIV and AIDS. It is a disease or virus that attacks the immune system.
And so that's when you get that AIDS diagnosis, is when your immune system gets to a really low level.
And HIV can be transmitted through semen, vaginal fluids, also through breast milk, and it can be transmitted through oral sex or any of that contact.
Yeah, and also through blood. So people typically get it through having unprotected sex with somebody who's infected, and then it can also be transmitted through any kind of blood contact, which is often through sharing needles. And then it can be contracted through breastfeeding or through childbirth if you're not getting treatment.
Right. And so the myth that it can be passed through drinking water, it can be passed through touching or sneezing is not exactly accurate.
We think about HIV as a community issue because it's a community issue because it's affecting communities and it's affecting populations disproportionately. And so it needs to be a community response. Putting it the ownership on just one individual will not end HIV. We need a community response to fight stigma, to bring access to resources, and to stand up and say this is something that we care about and is important to us, and it's important that everybody has access to those resources. One of the biggest things the community can do is try to work to fight that stigma, because stigma is the biggest reason that people do not get tested. They're scared to protect themselves, and then when people do test positive due to stigma, they're faced with a lot of mental health concerns and lots of things that affect them. And so by fighting stigma, it can make it easier for people living with HIV to get treatment. And by getting treatment, they're taking care of themselves and their community as all. So not only encouraging people to get tested, but also encouraging people who are positive to get into treatment and working to destigmatize
Prevention is something that we all have to take an active role in. And remembering that HIV and AIDS is just not a personal kind of issue. It's something that we all as a community have to experience.
HIV can affect anybody who's engaging in the kind of risky behaviors we talked about can be put at risk for HIV, but due to a lot of systematic issues, different populations are disproportionately affected by HIV due to a lot of issues outside of their control, and some of those could do lack of good information, lack of good education, lack of adequate health care. All of those things can really impact people's ability to protect themselves.
Especially the African American and Latino women. 31% tend to develop the AIDS diagnosis within the first year of being treated. And there's a lot of different reasons why that happens. Just the access to care, being afraid to go into the clinics, or being afraid to go, or not knowing where to go. There's also the issue of money. Not having transportation, particularly if you have needs of your children, you put your children first before you then take care of your needs, and so you're less likely to follow up on the medical care and take your medications as needed. You want to look at the whole family dynamic. So we often work with ladies who have children who have had the perinatal transmission and those that haven't. Just like with our conference coming up, we've got a mother-daughter dialogue, and so we want to talk about how teens are coping with their parents who who are positive, and how they're going through that and what's the stigma they're facing. We also, during our support groups, we try and educate the children, and we try and give the kids a different way of looking at things also.
And then on a more just logistical level, we offer that childcare during support groups, which is important for women who are taking care of families. And I know that the therapists, maybe you can talk about that more, Octavia, do sometimes work with families in the therapy
we work with
sessions.
families.
The rapid HIV test is probably the most common. Also because it's easiest, and that one is an oral swab. So they swab your mouth, and it sits for 20 minutes, and then you get the result. HIV testing in this city is mostly confidential but not anonymous. And what that means is they typically do take your name and your information. That is all kept confidential, but it's not anonymous. Tell somebody has HIV by looking at them, or by talking to them, or even by being intimate with them. That's only a question that really can be answered by talking to them and getting tested together, or asking them to get tested on their own. Testing together is something I encourage people to do when they are in a relationship and they're unsure of each other's statuses, or they're interested in having unprotected sex. Just because somebody has HIV, that doesn't mean that you can't have sex with them, or you can't be in a relationship with them or do anything with them. The treatment options available can really lower the risk of transmitting HIV to others, and when you pair that with protected sex, that can still be a safe way to engage in sexual activity.
Things we promote is the female condom campaign, which is using the female condoms because we want to give women the power to take care of themselves and to protect yourself.